To be honest, I just fell into working in mental health. I started at the clinic in Portland, and I didn't ever really see myself as someone who would be working in mental health. I considered myself someone who was too sensitive to do that, and I learned very quickly that something that I thought of as my weakness was actually something that would really help me in this field, and I got to learn a lot from the people that I worked with about how to be able to do it sustainably.
I chose to start working at New Narrative because I have been working with the houseless population for a couple years, and I really wanted to stay working with that population. What's unique about New Narrative's work environment and culture is that it's person-centered, not just for the participants, but for the staff as well. I feel like in my role, I have the opportunity to get creative with what my day-to-day looks like, and no day looks the same, which is awesome for me. I love the variation in my days, and I love that I am so supported in my work-life balance and being able to do what I like outside of work to the point where it's so easy for me to not take work home with me. I feel so supported by my supervisor and the other staff every day that I can really bring my best to work and then leave it at work. It's great.
My dreams and goals for my life are mainly just to make an impact where I can, and this population that we serve happens to be something I'm very passionate about, and breaking down systemic barriers, addressing historically marginalized populations and being able to support them. And that brings a lot of value just to my life and helps me stay passionate about life in general. And so this agency is very in alignment with those things, and they're very willing to support whatever career path, trajectory, trainings, resources that you need to make sure that you're feeling fulfilled as well within your work.
Dreams and goals for my life. Still kind of figuring that out, honestly, but I am really dedicated to learning how to be the best advocate that I can be, and New Narrative really offers a lot of opportunities through training and trials and just a lot of support in order to navigate that.
New Narrative does really try to make sure that you are able to talk to your supervisor, teammates about being able to take time off when you need to, if you need breaks, breathers, and being able to pace yourself. A lot of the programs also give you a lot of autonomy over your own schedule, and so it gives you choices in how you rearrange things to make sure that it's meeting your pace.
New Narrative's culture is really focused around building our teams, building different ways that we can advocate, and focusing on how to serve the harder populations that other agencies don't always seem to work with.
The most surprising thing about working at New Narrative, I don't find it surprising anymore, but was just seeing what mental health could be, what mental health could look like. Before coming into this field or listening to the news, there's a lot of stigma around mental health. There's a lot of thoughts around people being the expert on people and telling people what to do, and really people are their own expert, and that is just such a big theme here, and really one of my favorite things about working here.